Thank you for this opportunity to present our work on using ScarWork to improve surgical scars for head and neck cancer survivors. My name is Beverly de Valois, and I have no conflicts of interest to declare. So I'd like to start by setting the context for this presentation. In the Supportive Oncology Research Team, SORT, we have a three-step ScarWork program at the moment. Today, I am presenting on Step 1, our head and neck cancer clinical pilot, and tomorrow I'll be presenting Step 2. Head and neck cancers account for just over 5% of the global cancer burden. In the UK, up to 59% of head and neck cancer patients will survive 10 or more years after curative intent treatments, and these include surgery, radiotherapy, and systemic anti-cancer therapies. These treatments may cause scarring that are local to the tumor site or also on the limbs and torso from donor graft sites. And the consequences of these scars include altered appearance, functional impairment, psychosocial issues, and a diminished quality of life. In the Supportive Oncology Research Team, we are interested in exploring ScarWork. This is a light touch manual therapy. It's hands-on, it uses no lubricants or medical devices. It addresses tissue damage associated with scarring, such as fibrosis, adhesions, and contracture. ScarWork was developed in the USA by Sharon Wheeler. It's a novel therapy introduced to the UK in 2014, and to date there is largely only anecdotal evidence about its effectiveness. Wheeler et al. Have published one abstract. So the aims of our project were to set up a small pilot clinic to assess ScarWork, and we wanted to find out if ScarWork was acceptable to head and neck cancer survivors, if it was effective in relieving scar-related symptoms, and we also wanted to test some potential outcome measures. And we were doing this with a view to developing further services and some possible research. So to do this, we set up a clinic that ran once every 2 weeks, so a fortnightly clinic offering 1-hour ScarWork treatments, and this ran from November 2017 to June 2018. Head and neck cancer survivors could self-refer or be referred by their healthcare professionals, and they gave us written consent for use of their de-identified data and photographs. We used validated patient-reported outcome measures at baseline and end of treatment, and the two measures that we chose were the Patient Scar Assessment Questionnaire, or PSAQ, which has 4 subscales for appearance, consciousness, satisfaction with appearance, and satisfaction with symptoms, as well as some questions about symptoms. And we used the Measure Yourself Medical Outcome Profile, or MIMOP. And this is a patient-centered, individualized questionnaire that measures outcomes that the patient considers important. We also took photographs for a visual record. So our results. We had 4 male head and neck cancer survivors come to the clinic. One of these men withdrew after 4 treatments because of a cancer recurrence, and although he returned for further ScarWork treatment, he did not return any end of questionnaires. But at baseline, the characteristics of our 4 patients, they had an average age of 63 years, ranging from 51 to 72 years. Their scar age was 37 months, or just over 3 years on average, but that ranged from 4 months to 7 years. They reported a median of 2 scars each, but that ranged from 1 to 6 scars, and they had a median of 8 treatments each, but that ranged from 5 to 11 scars. So the analysis that I'm going to present next is conducted on 3 patients who reported 5 scars. So here are our PSAC outcomes, and you can see that we have some improvement. The red bars are baseline, the green bars are end of treatment, and you can see we're moving in the right direction. The scores are becoming lower, and this shows that things are improving for these patients. And so this would appear that there is a trend toward improvements in areas including appearance, satisfaction with appearance, consciousness, and satisfaction with symptoms. Our MyMop outcomes again show a tendency towards improvement. Again, you can see the red bars at baseline and the very big difference of the green bars at end of treatment. Now, on MyMop, a change of half a point or more is clinically significant, and the patient will be aware of the change. And so these patients seem to be reporting that they've experienced great benefit. The symptoms that they specified included numbness, tightness, appearance, itching, lumpiness, pain, pins and needles, restricted movement, and sensitivity. And the activities that they reported were being restricted by their scarring were lifting, moving the head, moving the neck, and social and sports activities. So I'd like to now just to focus on the individual patients. This man had 3 scars that were just about 3 years old. He attended for 9 treatments, and I presented the graft scar on his wrist here because that had an enormous change after just 3 treatments. And the important thing to notice in these before and after pictures is that in the after picture, he's wearing a watch, okay? So wearing a watch was very important to this man. The pain in his wrist was so great that he could no longer wear his watches. And after 3 treatments, so after 6 weeks, he had such an improvement he could wear his watches again. And this was a great thing for this guy. After 9 treatments, he said that he was pain free in all his scar areas, so both on his wrist and the 2 scars on his neck. Uh, he could shave and have no soreness after, so he had great discomfort shaving, and he felt the benefits in many areas. So his sleep improved, his wearing of watches again he could do, and he could lift weights with his left arm. And I think it's really important, his feedback that shows us just how far reaching these effects of scarring can be into daily life. This patient had 1 scar, which you can just about see here, and this was 7 years old. He attended for 11 treatments, and I think what's interesting about this patient is not so much his scar, but the damage from the radiotherapy. And he said that his scar was very angry looking. It felt like leather before he started treatment, and he had a lot of uncomfortable sensations. But at the end of treatment, he said the skin was smoother. He felt his neck belonged to him again. And I think what's interesting is the kind of emotional and psychosocial effects this had. He felt better in himself. His confidence improved, and he felt more positive about the future. And he said that if the ScarWork clinic had been operational when he'd finished his cancer treatment, it would have saved him 7 years of discomfort. This man was 4 months post surgery, and he found that the scar work was beneficial to him both physically and emotionally, and it had a huge mental effect to his recovery, and that this was just very valuable to him. So, in conclusion, this is a small exploratory project. It has many limitations. However, what we have established is that scar work is acceptable to head and neck survivors. It seems to have potential for relieving scar related issues that are both physical and psychosocial, and it allowed us to test out our outcome measures. So, for us, it was worthwhile. It attracted management support and funding for future work. So, if you're interested in reading more about these individual patients, we have a poster handout that's available at this website address, and you can email me at beverly.devalois@nhs.net for further information. I'd like to thank you very much for your attention, and Thank you.